we're speaking with Dr. Tony Harries of the International Union Against Tuberculosis and Lung Disease. Dr. Harries, what nations have the highest diabetes burden?
It's really the nations of Asia. So China has the highest diabetes burden in the world. Probably now with over 100 million people living with diabetes, and almost the same number with what we call pre-diabetes, who, if they don't have things put right, will develop diabetes. So a large number of people with diabetes. India comes second, according to the literature. And then the other big countries would be Indonesia, they'd be the Philippines, Pakistan also has a high burden. I think Bangladesh, from what I read, has a high burden. And then you go to Africa, you've got countries like South Africa, Nigeria.
And what is it about behaviors or health in those nations that gives them such a high rate of diabetes?
Well, I think it's been, in the last 40 or 50 years, a change in lifestyle. I mean, I think if you look at what's happened, there's been urbanization, building of big cities, people drifting to the cities for work. And I think along with that drift to cities and urbanization comes a change in diet. So people tend to eat food that is fast, that is fried, that has oil in it. Basically, it makes you at risk of getting diabetes. The beverages, the highly sugared beverages like Coca-Cola, Sprite, Fanta, they're not good for you. So one adopts a lifestyle, a dietary lifestyle that is puts you at risk of getting diabetes, and also you do less exercise. So as you drift to the cities, people take minibuses, they take buses, they don't walk as much as they should do. And as we discussed in our talk just a few minutes ago, I think there's a genetic component here as well, where essentially in India, China, Indonesia, people born essentially to survive a harsh environment, and that harsh environment being lack of food, lack of sugar. You then replace that environment with too much sugar, too much food, too much carbohydrate, and those people have a problem coping with it. And so, if you like, they are diabetogenic. They are at risk of diabetes given a change in lifestyle. So I think this is why we've got the problem.
Mm-hmm. You've mentioned some things that are controllable just by human nature. I mean, if I would drink less Coke and fewer fries, I would be less susceptible to diabetes. How would that, simple lifestyle changes, how would that affect the incidence of diabetes?
I think it would probably make a big difference. I'm not a diabetes specialist, but I think it would make a big difference if we really got a handle on this. But I think it's more than nudging people in the right direction. The work Mayor Bloomberg did in New York, where I would call action-orientated public health, I think that's the way to go. You tax the things that are bad for you, and by doing that, you have a reduction in people who then use those bad things, if you like. Yeah, you give people good information about calories that they may have in their food at a restaurant. Well, that makes people sit up a little bit and say, do I really want to eat this plate of food that's 2,600 calories, or would I prefer to go for a plate that's 1,300 calories? You with me? So I sort of feel active public health is the way forward. Now, people would criticize that and say it's the nanny state interfering with people's individual rights for freedom. But at the end of the day, if you get diabetes, somebody's going to have to pay for that. Yeah. In my country, Britain, we have a national health service, so it's paid for out of taxes. Can we afford as a nation to pay for that care? Maybe it's better to try and prevent it with some rather tougher public health action. So I'm in favor of prevention rather than cure, especially as there's no cure for diabetes.
All right, thank you, Dr. Harries.